So, we're gonna have a testing station. Mr. Nick, myself, or Miss Tracy, or Miss Vanessa, we will be testing you on if you know how to read the syringe length, the syringe. So, a syringe is comprised of what? We tested on this. You had a test. Maybe that's a 103. Correct.
Is it CCs?
Like a certain amount of ml.
So what is this?
Barrel.
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 Okay. What's this?
Plunge.
Plunger tip. This is a plunger. Okay. So when you're reading this, you're reading not at this bottom line, but you're reading at this very top line. Do you see how it kind of comes to a point at the very tip?
Yeah.
So you're always reading this here, not the second one, and definitely not the third one. So Mr. Nick made a really good point this morning. I said, I've never seen a 12 cc syringe out in the field. He is currently out in the field. So on Monday, he saw a 12 cc syringe, okay? You are still only drawing up to 10 when you are out in the field. Because if you pull it up all the way to 12, you're gonna get confused. So if you just do it by increments of 5s or 10s, it's way easier to calculate. Okay,
And just to be clear too, you guys make sure, this is an important comp, I think, because this is for charting purposes. This is like legal documents. So if you say they use 3 cc's and the patient had a code issue in PACU, and technically they used 5, but you didn't say that, that's a liability. So that's why it's very important to make sure you guys understand how to read the local, how to actually administer it, and how to make sure you're giving the proper amount back, because it's a legal document.
good point. Okay, so when you are labeling, you are always writing the name of the medication. The volume, I don't really write. That's not something you have to write, but it is something you have to know. So let's say, for example, this is a 30 cc. It's gonna tell you how much it is all the time. It'll tell you 30 cc's. If the nurse comes and dumps that in there, you know that that's 30 cc's if she put the whole thing in there. That's 30 cc's. So if you want, you can write you started with 30 cc's. Okay, so we're gonna I'm labeling my medication this, and now I'm gonna draw up in here, so I'm also going to label my syringe. I do have another one. So here I'm gonna write the expiration date again, which is 8/20/28. When you're labeling these, don't cover the numbers, okay? You wanna be able to see what that is. And I almost always do it where it says for single use, I light it up the same way. Okay, so I'm gonna draw up my medication here. I'm not gonna trick you guys and fill it up to 12. Okay, I'm not gonna do that.
I will. No, I'm sorry.
You will too. Mr. Nick is very nice, he won't do that. Okay, so it's important to take the bubbles out, but we're not gonna spend 20 hours taking the bubble out. Why? Where is this going? With this lidocaine, where is this going? If you're doing a open reduction internal fixation, if you're doing an ORIF of the wrist, where is this going?
In the IV?
I am.
Topically?
Yes.
Oh.
It's going in the, where's the little ones? Oh, those are the smaller gauge ones.
22 gauge?
Oh, yeah, okay. Intramuscular, or sometimes they'll even just shoot it inside of, since it's already open, they'll just kind of put it inside, or they'll put it into the tissue. So you don't really need to be precise and take all the bubbles out, but just make sure it's not like, you don't have a huge bubble like that.
Yeah.
You know, just kind of shoot it up to the, to where a little bit comes out. Make sure it's at 10. So if you pass this around, you'll see that it's right at the 10. Okay? You're gonna make sure it's at the 10. I am then going to inject, so just pretend that this is labeled already, okay? Nick, if I'm making this too difficult, you tell me. Okay, so that's at the 10. It's labeled Excidofen. I mean, like 1% lidocaine. And then in this one, I'm going to have Lidophenol, which is a medication that is mostly used commonly in eyes. It's also I'm not sure what the fennel part is, but lidocaine is to numb. So they're going to inject the eye to numb the eye to work on a cataract or to, take out some debris or something that's in there. So this is also going to be labeled lidofenol. This is not something you have to do during your comp, but I'm going to show you how I do it when I'm out in the field. All right, so I'm going to write it's lidofenol, and expires 01/2025. Because it's so little, I grab a pair of scissors, and this is probably just because I'm extra, okay? I'm gonna cut this label in half so that I have 2 labels for any other syringe. And I'm gonna label it where it says single use only, this way. And well, obviously if it, I think I can do it this way. I'll do it in half this way, so you can kind of see what I mean. So I'm gonna label it like this, so that my numbers are still showing. I have the name of the medication and the expiration date. And then there's the little one. For eyes, it is very important that there are no bubbles in this, okay? This is the one where if it's gonna take you 30 seconds to make sure there is no bubbles before you pass this off, that's fine, okay? The best way to do it, in my opinion, is to kind of hold here. If there is a giant, I say giant for eye. There is a bubble between 0.1 and 9.5. So I'm gonna draw it like this, let go of that bubble's floating up. Did you guys see that?
Yeah.
Okay. I'm gonna flick it a little bit. Some's coming out, which is actually a lot for the eye, so I might bring it back down and push it back up. I'm gonna not shoot out here. I'm gonna put this hypo on top, and then I'm just gonna take this off so I can see exactly. Eyes are very specific and tiny, so I wanna make sure that it is primed, because you don't wanna inject air into the eye, okay? So that's primed. I can see some is coming out already. So if I started at 1 and now it's at 0.9, I'm going to make a mental note, or I'm gonna, on my spinning card or whatever, I'm gonna write, can I write on this? Or on my table, I'm gonna write, I am starting my lidofenol with 0.9, so that I know how much is in there.
Do you guys
Oh,
filter?
what am I doing?
There's no filter, right?
There's no filter needles, so we'll get to filter needles.
No, not
Good question.
filter needle.
Oh, what do you mean filter?
No, I don't know. For eyes or
Yeah.
just in general? No, I just know that.
Is that-
A filter needle?
Not a filter needle. They're called filters. that we put when we do filter for ice and all that.
I
Like
don't know what that
the
is.
blue dye?
Yeah, not blue dye, but. I'll
Okay, you'll have to
read it.
explain to me. Okay, so I'm gonna recap this. When you recap any needle, you're using one hand, okay? You're not using 2 hands. So if it's easier for you to put your hand on your panza, put your hand across your stomach, recap like this. It's always easier if you recap going straight and not at an angle. So parallel to the table, you can touch the table is not contaminated, okay? There, up, press down. When you are going to pass this to me or to Mr. Nick or to any of the teachers, you're going to read out the medication. I have lidofenol. You don't specifically have to say the expiration date out in the field. We don't say the expiration date. We just say at the very beginning during our timeout. I have lidofenol in the field, and I check all the expiration dates. That's all good. You're gonna say that at the beginning. Okay. So this is how I do it. If he is my surgeon, I'm gonna pass him this lidofenol, which is why I always put the labels the same way every time, so I don't have to be like, oh, I don't know. I put the label the same way. I hold this pencil tip at the bottom. I take this off with my left hand, and I'm gonna do this motion. Cap comes off. My wrist is going to do this. And I'm gonna pass it to him like this, keeping the needle away from my hand. And once I can feel that he has it, I'm going to let go.
Wait, Ms. Celia, can you do that again?
Yes,
so
I
I can
can.
record that
Can you
specific
stand in
part,
front of me?
please?
Sorry. All right, here we go. So,
Thank you.
do as I do, Do as I say, not as I do, okay? It's a little bit easier for me to do this right here. Okay, so. Hand, left hand on the, what is this called? Cap.
The cap.
Cap. You're gonna take it off. I have Lidofenol. You're gonna pass that. He's going to inject. Oh, I forgot the most important part. Check how much. So I already said that. Okay, so you're starting with 0.9. All right, so I'm going to recap this. And it is actually at 0.55 because it's between the 5 and the 6. So I'm going to pass this around so you guys can look at that. Okay?
So how much should we use?
It is how much was injected is what we're going to. So what was left over?
It was
What was
5.5.
5.5?
Because it was
I
4.5.
suck at math, okay?
4.5?
I'm gonna use my fingers
So
because
can
I'm
you count
horrible with
mine?
math. Okay, 5.5,
1, 2,
6.5, 7.5,
No, you don't.
8.5,
1,
8.5 to 9
2,
is 0.5.
Yeah.
Alright, so I
Yeah.
used
Yeah. Yep.
3.5. But it's not really 3.5 because it's such a small, so it's 0.35.
So Miss
Okay.
Aleda, when we're doing this, do we unpack all of those?
This will all be
Before-
sterile.
Oh,
okay.
okay,
This is
okay,
all gonna be
okay.
sterile. This is the sterile procedure.
Okay.
We're just
okay.
passing, essentially when the comp starts, we're just passing.
No. So yes,
That's
you
all.
are passing, you are notating how much you're starting with because I'm gonna give you a specific amount. Not everyone is gonna have the same amount. Your comp, when you give it to me, I'm gonna write certain numbers on it. Okay, and you're not gonna see those numbers. I'm gonna write the numbers down so that there is no arguing between, well, it was this much, not this much. No, it wasn't. Here it is. This is the syringe that we started with. This is the amount that was injected, and this is how much was left over. I don't want to know how much is left over in the syringe. I want to know how much is injected because the nurse is going to ask how much was injected, how much local did we use, and so that's the number that you're going to give them. All right. So 1 second. So we started at 0.9 on the 1 ml syringe. What was left over was 5.5. What was injected was 0.35. If that doesn't make sense, just think of it as 3.5 was injected. You're just gonna move this over like in regular math and put a 0 in front of that. 0.35 was injected. That's how much was used. Okay? So same concept for this. All right. I'm gonna say, or Mr. Nick's gonna say, give me the, I want the lidocaine. So you're gonna go through your, I give it to you. You're gonna go through your syringes. You're gonna say, all right, I have 1% lidocaine. You're gonna check how much is in here. Okay, so let's say, for example, I drew up 8 for you. It's not that it's going to be 8 when it's drawn up for you at the field. I wanna know is, can you do the math? Okay, this comp is more on math. Can you tell us how much local was used at the end of the case? So I'm starting off with 8. I know I have 8. I'm writing down 8 in my head or on my note card. Surgeon's gonna say, can I have,
Oh, can I have the
you're just
local?
gonna say local, yeah. Can I have the local? All right, I have 1% lidocaine. You don't have to say when it expires because you already checked with your nurse. You said it before during the procedure that everything was good, expiration dates were good. All right, I have 1% lidocaine. Same concept. Left hand on the cap, right hand, hold it like a pencil. And then I'm gonna take it back from you really quick, okay? It's this, okay? It's one motion. It's not, let me show you what some of the other students have done. Oh my gosh. Okay, I got 1% lidocaine. They do it opposite. They do it this way, but now they have to do this, which is awkward, right? They do this. Look at how close that is to me.
Yes.
Okay? Don't be that person. Don't and stab yourself. This is awkward because it points at me. Where if I do it with my right hand, it's not going to be pointed towards me. Okay. Pencil, remember, pencil, cap off, injects. He's going to inject however much. He can either give it back to you or he can put it down. Most of the time, that's what you're gonna get at the Mayo Stand,
So
okay?
don't try to reach for it. Just
No.
let the doctor put it like that.
When my surgeon has a sharp in their hand, my hands are here or on this side of my Mayo stand. I am nowhere near them because they're not focused on your safety, they're focused on the patient, okay? So I'm gonna take that back. I'm gonna recap it. See how I'm so used to doing this that it's automatic for me. Lift that up. You could do it this way. Or you could do it this way. Either way I'm fine with. I don't wanna see you guys putting this here. I don't wanna see you guys doing this because this is what you do at work. I don't want that, okay? Up. So this is a really good one. It's almost at 5. So you're not gonna say 4.95. You're always gonna err on the side of more than less because
So round up.
round up just a little bit.
Okay.
So if I started at, oh shit, how much was it? Sorry, it was 8.
Yeah.
I didn't mean to say bad words, sorry. It was at 8. Okay, see, I didn't write it down, which is why you need to write it down. So now it's at 5. So I injected 3. Okay, nurses gonna say, how much was injected? You're gonna say?
3.
3 what? 3 cc's? 3 mils? Okay, so 3 mils and 3 cc's is the same.
Oh.
Out in the field, most of the time I hear cc's.
Yeah.
CCs, yeah.
I hear cc's, but these are mils. Don't be confused. Those are the same thing, okay?
So we can say, even for that one, we can still say 3 cc's?
Yes.
Yeah.
Okay.
Mhm. 3 cc's were injected. If you tell me there's 5, okay, good for you. I don't care. I don't care that you have 5.
How much
I
did you
wanna
start
know
with?
how much did my patient get?
Yeah.
Okay, so if during your comp you say, we started with 8 and now I have 5. Okay, if you don't say we injected 3 cc's, then it's a 0. Okay, do you have any questions?
Yes. When we're starting the comp, are we starting it by asking if there's any medication?
Good
And
question.
are
Let's
we-
look at that really quick.
Asking if they're allergic, like how we have been?
So, correctly identifies amount drawn up. So, no. And the reason is, this is as if you were already scrubbed in. This is like the end of the procedure, or sometimes like the lidophenols for the eyes will be at the very beginning of the procedure.
Okay.
So you have already confirmed allergies, you have already accepted the medication onto the
Okay.
field. This is intra-op.
Okay.
Some of
So
those
like when we're doing
items,
our count to see where we're at.
Yeah.
yes, so
Okay.
that is all pre-op.
Mhm.
What does that mean? What is pre-op?
It happens
Before.
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 Before the surgery, before the first incision, before our timeout, okay? Intra-op is
During.
During.
and post.
After.
What happens in post-op?
Clean up
During
and then
this,
find-
during this comp, what is the post-op portion?
Counts.
You're telling them how much you have left.
Yeah.
There you go,
Mhm.
that's a post-op. So we don't have a pre-op, we only have an intra-op and a post-op in this comp, okay? Any questions? Now's the time to ask.
So I have another question.
Yeah,
So
that's
when we're
okay.
starting off, since we already went over the expiration date and
Mhm.
everything, when we start the comp, we just say we already went over the expiration.
No, you don't have to because you do
okay.
that during your
Initial.
pre-op timeout.
Okay, so we don't have to mention that we already went over the expiration.
No.
Okay.
Right.
No.
I'm okay with you not doing
Okay.
that. So we do that. The reason why things change during the progression of this course is because at the very beginning, we're trying to get you to understand, okay, expiration dates are important, which is why in 100s or 102 even, I do make you say 1% lidocaine expires 8/20/28 because I'm trying to instill and ingrain in you that expiration dates are very important. And 103, you should already know that foundational skill, so we're just building on the skill. It's not that you're forgetting that you have to say that, it's just something that you should already know.
Okay.
Okay, so intra-op, you already have the expiration date, you have already confirmed with your nurse. 1% lidocaine, boom. If you do not mention the name of the medication to the surgeon, I think that's points off too. So correctly identifies amount drawn up, correctly identifies each mark, so how much you're given. So the correctly identifies part is you saying what the medication is. because that is the correct way to do it. It doesn't spell it out word for word, but correct means all encompassing the right way to do something. Here, you need the keys.
Okay.
Sorry, this is my kid, everyone. This is my oldest. I think it's this one.
And so we just have to do that before each pass, not at the beginning, we don't have to identify each one,
Right.
just before we pass each
Mhm.
time.
So sometimes I won't even say, I'm not gonna tell you specifically, I want this or I want that. Maybe I will, but I'm also gonna say, give me the medication without epi, just leave it there. Give me the medication without epi, because, so here we have 1/4% Marcaine plain. Quarter percent Marcaine plain. This one would be, 1/4% Marcaine with epi, or 1/2% Marcaine with epi, or 1/2% bupivacaine with epi. Usually we have 3 syringes, but you guys got lucky and you don't. So if I say that, then you're gonna look for your syringe. Which one does not have epi? Okay, this one doesn't. All right, I have 1% lidocaine, plain. It is important to say when it is plain. It's most important to say when it has epi. If it's plain, you can say it's plain.
Mhm.
But if it has epi, then you always say it's 1/4% Marcaine with epi, 1 to 100,000. Boom. So that triggers 2 different things. The surgeon's gonna know that the epi does what?
Distributes it, the medication.
No. What is epi for?
It's a muscle relaxer.
Vasoconstrictor, right? It's gonna prolong the effect of the medication that's being administered. Okay? That's important for 2 reasons. 1, so that the surgeon knows what they're injecting. 2, it's anesthesia's listening. Okay? We're about to inject local with epi, because what else does epi do? So it constricts, which causes the heart to do what?
Eat faster.
Beat faster. So,
And they
If
will
you-
notice the anesthesia will be
will.
like, hey, stop, the heartbeat's going fast. And they go, oh yeah, we have epi.
so if you don't say with epi,
Yeah,
they're going to be like,
they'll start freaking out.
what's happening?
Why is the heartbeat so
Why is the
fast?
heartbeat so fast?
Gotcha.
And we're like, oh, the local had epi. Well, can you please say that next time? It'd be nice to know. They'll say some snarky, sarcastic comments, okay? So cover your bases. It's a protection for yourself. It's a protection for your patient. It's a protection for everyone. So that is my very long speech on this comp. Any other questions? Take a look at your comp really quick.
Where do we write down how many cc's